United Health Foundation recently released America's Health Rankings 2022 Health of Women and Children report, which highlights improvements, challenges, and disparities in the health and well-being of women and children across all 50 states. Kansas ranked 26th and Missouri ranked 37th this year. Dr. Ravi Johar, Chief Medical Officer for United Healthcare, is here to tell us more about the findings. But before we dive in, Doctor, can you tell us what exactly is this report?
Sure. America's Health Rankings is a compiling of publicly available databases. We look at 121 different measures that go into health. And, the things you think about, like medical costs and things of that sort, but also behavioral and social, access to water and food, things of that sort. Everything that goes into making up your health. This is the 33rd year that America's Health Rankings has been done, but the 6th year that we've looked specifically at women and children.
So what are some of the overall findings about the health of women and children in the country?
Well, we found out that we have some significant challenges. A lot has changed in the last few years, mainly around behavioral and mental health. So I think those are some things that really struck out. Kansas was one of the worst ones for an increase in anxiety for children. So that's one thing we really want to look at. Mental distress is a really big issue. So that's something that I think was highlighted by this report.
So for Missouri and Kansas specifically, what are some of the biggest strengths? And then on the other end, what are the challenges?
For Kansas, some of the strengths are there's a high prevalence of singing, reading, storytelling, just communication with the children. So that I think is very, very important. There's a lot of physical activity, and then there's a high prevalence of dental visits for women, all of which are really good, dramatic things. For Missouri, some of the strengths are there's a really low prevalence of illicit drug use among youth. There's a high prevalence of physical activity, and the women in Missouri are doing a good job of getting screened for cervical cancer. For Missouri, some of the challenges is there's a very high child mortality rate. That's concerning. There's a high prevalence of adverse childhood experiences, which goes along with all the mental health and anxiety issues we talked about. And then there's a high prevalence of cigarette smoking, especially during pregnancy. For Kansas, some of its challenges are there's a lot of prevalence of multiple chronic conditions among women. There's a high prevalence of the adverse childhood events. And then there's a very low supply of pediatricians. Kansas actually ranks 48th in the country for the number of pediatricians available.
Oh, wow.
Which is a real contrast. Missouri is 5th. And Kansas is 48th. So I'm not sure why there's that dramatic difference there.
Yeah, that definitely is a dramatic difference. What can community leaders, policymakers, and healthcare providers do to improve the health of women and children?
The idea of this report is to basically give a scorecard and show how you're doing compared to other states also. So you can look to see which states are doing better in areas that you want to address and maybe use that information to try to help mold your policies and also see what areas you really need to focus in our states.
And where can we learn more about the report?
AmericasHealthRankings.org has the complete report with lots of additional information and graphs and data. That's an excellent, excellent source to go with.
Well, thanks so much for joining us this morning.
My pleasure.
To learn more about the America's Health Rankings 2022 Health of Women and Children report, go to americashealthrankings.org.